Healthy heart for life. You may use expressions such as my heart is broken or give someone heartfelt thanks. But are you aware of what the heart is doing every minute of your life? Your heart pumps 2,000 gallons of blood through your body every day. Given the complex and vital function of this organ, it is not surprising that things can at sometimes do go wrong. Heart disease affects all of us, either directly or indirectly. It is the leading cause of death, both in the developed economies and developing nations. You may feel bombarded with conflicting information about heart health. What is good, what is bad, and what do you really need to know? Most heart disease is preventable, and keeping your heart healthy doesn't require a lot of time and effort. Small changes such as standing up and moving more can make a big difference. The changes do not need to be negative. In fact, one of the most important keys to healthy heart is learning to enjoy a full and active life. Many risk factors for heart disease are factors you can change. If an emergency happens, prompt action save your life. If you already have a heart condition, there is a lot you can do to make sure you live well despite your condition. The key point is you have far more control over your heart health than you may realize. Warning signs of heart disease. We have all heard stories about someone like X or Y who thought he or she had indigestion when it was actually a heart attack. Mistaking a heart attack for something else is common. In some cases, heart attacks and other heart problems do occur out of the blue with no prior symptoms. But if you do experience any of the symptoms, which I will mention, have them checked out. Number 1, chest pain or discomfort that you notice with physical activity or emotional stress, which goes away when you rest. Number 2, unusual tiredness. Number 3, shortness of breath during normal physical activities. You need to call for emergency help from your health care provider if you have 1, unexpected chest pain or discomfort that doesn't go away after a few minutes or occurs when you are resting. 2, discomfort in other areas of your upper body such as your arms, shoulders, back, neck, jaw, or stomach. 3, shortness of breath that doesn't go away. 4, severe weakness, lightheadedness, cold sweat, or fainting. 5, severe indigestion or heartburn that lasts more than a few minutes. Feeling sick to your stomach, vomiting, or abdominal discomfort. The symptoms may be subtle, especially in women. If you are not sure what is going on, but it feels different or troublesome, get yourself checked out. Don't delay. Delay can be fatal. Risk factors for heart disease. Your heart health starts with understanding your risks. Taking an honest look at different factors that may increase the chance that you will develop heart disease. A risk factor could be a medical condition, a behavior, a specific gene, or something in your environment, any of which, alone or in combination, could affect your heart health. Very often, if you already have heart disease, these risk factors increase the chance that your condition will worsen. Of all the risk factors for heart disease, most are things you can do something about. Improving these factors is what you can do. Take specific steps to change your risk profile and prevent future heart problems. The more you learn about heart disease, the more you can do something about it. Some common risk factors for heart disease include 1. High cholesterol levels, 2. High blood pressure, 3. Diabetes, 4. Obesity, 5. Smoking, 6. Lack of physical activity, 7. Age, 8. Personal or family history of heart disease. It is never too late or too early to start. When you do, you will also boost your overall health and longevity. And believe it or not, when you control your risk factors for heart disease, you reduce your risk factors for many other conditions, including dementia, cancer, diabetes, kidney disease, erectile dysfunction, and blindness. Get started. Right now is an easy 2-week warm-up to the full program. Eat 5. Boost your heart health by eating at least 5 servings of vegetables and fruits every day. Move 10. Increase activity and exercise at least 10 minutes more than what you typically do every day. Sleep 8. Get 8 hours of sleep every night. Doing it for 2 weeks may get you hooked. Get ready to start. There are many ordinary but effective measures you can take to prevent heart disease. They're often part of routine activities you do every day. This is the basis of the quick start approach. Simple actions that make an immediate positive impact on your heart and provide long-term benefits to your health. Caution. If you are significantly overweight and have been inactive for several years, you and your doctor can choose activities that are safe and beneficial for you. Motivation carries you through periods of frustration, anxiety, and boredom, all of which you will experience at some point. It also helps you focus on the long-term goals of the plan. The key to motivation is that it has to be personal. The reasons for taking action should be your reasons and not someone else's. The best motivation comes from within you, and without that internal drive, any goal will be difficult to achieve. A quick start is just what it sounds like. It means you take immediate action. And eat 5, move 10, sleep 8 are the goals upon which you take action. The quick start lasts for only 2 weeks. A word about serving sizes. Don't confuse servings with portions. A serving is a specific amount of food measured in cups or ounces. A portion is the amount of the food you put on your plate. Use visual cues to estimate serving sizes. Think of a single vegetable serving as being about the size of a baseball. A single fruit serving is about the size of a tennis ball. That's all you need to know right now. Work on your goals. Eat 5 servings of vegetables and fruits. Move 10 minutes more. Sleep about 8 hours at night. Follow these goals for 2 weeks. A word about exercise intensity. Moderately intense means activity that causes you to perspire lightly and breathe a little more heavily. Examples include brisk walking, casual bicycling, water aerobics, ballroom dancing, and general gardening. Exercise at more vigorous intensity includes jogging, fast bicycling, swimming laps, aerobic dancing, and heavy gardening. Eat 5 servings of vegetable and fruits. Start by eating breakfast and including at least 1 serving of fruit or a vegetable if you prefer. Eat a slice of melon or half a grapefruit, or add berries or banana slice to cereal or yogurt. Never pass up a chance to add extra vegetables or fruit to food you normally eat. The amount of vegetables and fruits you can eat in a day is unlimited. These foods are really that good for you. Go ahead and pick from a wide selection of types, colors, textures, and flavors. The more variety, the better. Move 10 minutes more. Add at least 10 minutes of moderately intense physical activity to what you already do every day. Official recommendations are for you to be active about 30 minutes a day on most days of the week. But the bottom line is, many people don't even come close to that amount. Walking is great because it is simple, safe, inexpensive, and you can do it almost anywhere. Fit 10 minutes into your work routine, such as having walk and talks instead of sit-down meetings. Walk when you make phone calls and exercise while you watch TV. If you are already exercising regularly, focus the extra minutes on adding new kinds of activity to your program or doing more vigorous exercise. Sleep about 10 hours at night. Sleep is something that many people claim they need more of, but never have time for. It keeps getting squeezed out by a lifestyle of 24/7 communication and quest for success. The quick start asks you to get 8 hours of sleep every night. There is no denying that. A good night's sleep restores energy and improves your disposition. Lack of sleep can make you prone to forgetfulness and fatigue. What you may not know is that quality sleep is good for your heart. Quality sleep may require changing your bedtime routines. It may force you to turn off your cell phone and computer in the evening. You may have to learn how to relax. These are small changes that make a big difference. Treat sleep aid as a general guideline. Depending on your circumstances, you may require a little more or a little less than 8 hours. You will learn about finding your slumber number later. Try to stay within the 7 to 9 hours range. Check your scoreboard. After 2 weeks, you can analyze your scoreboard or scorecard. The results may give you a better idea of what is more effective for you in establishing new habits or breaking old ones. Remember that what works for someone else might not work for you. 10 steps to heart health. Eat healthy, be active, sleep well, deal with tobacco, deal with weight, know your numbers, know your history, set your targets, take your medications, plan for emergencies, enjoy life. Eat healthy. Changing your diet can be a challenge. It's not that you can never eat a burger and fries again. Rather, your focus shifts to choosing healthier foods most of the time, a lunchtime salad, chicken or fish instead of red meat, an apple instead of a cookie for snack. Some of the most important actions you take to improve heart health involve your diet and eating habits. What you eat raises or lowers blood pressure, blood cholesterol, and blood sugar, and it governs weight control. It can also reduce your risk of heart disease. 5 keys to a healthy diet and healthy heart. Use these key points to build a healthier diet. 1. Boost your vegetables and fruits. 2. Eat breakfast and eat it right. Eating a healthy breakfast is one of the best ways to ensure that you have a varied, balanced and moderate diet. When you eat breakfast, you are more likely to get the vitamins, minerals and fiber you need for good health. Breakfast helps you control weight, reduce fat intake and lower cholesterol. You may also find that eating breakfast improves your concentration and productivity during the day. 3. Go to the grains. Grains, especially whole grains, are an essential part of the healthy diet. All types of grains are good sources of complex carbohydrates and key vitamins and minerals. Grains are also naturally low in fat. Better yet, they have been linked to a lower risk of heart disease. When choosing grain products, look for the word whole on the packaging. Whole grains still contain the bran and germ, which are sources of fiber, vitamins and minerals. The refining process for flour strips out the bran and germ. And just because the word wheat appears on the packaging does not mean it is a whole grain. Whole grain includes whole wheat bread, pasta and crackers, brown rice, wild rice, oatmeal, barley, bulgur, buckwheat, kasha and popcorn. 4. Focus on fats. Of all the changes that can make your diet heart healthy, reducing the amount of saturated fat and trans fat, think solid fats such as butter, margarine and shortening in the food you eat may have the greatest impact. These fats raise your cholesterol levels and increase your risk of coronary artery disease, heart attack and stroke. You shouldn't try to eliminate all fat from your diet. You need some for good health, but certain types of the fat are better than others. Choose monounsaturated fats such as olive, peanut and canola oils, or polyunsaturated fats found in nuts and seeds. Just remember that all fats, good or bad, are high in calories. A word on salt. Most people eat too much salt, sodium chloride, almost twice as much as they need each day. Reducing your salt intake helps lower blood pressure and your risk of cardiovascular disease. Most dietary sodium comes from processed foods you eat. The additives that help preserve food and enhance taste also are loaded with sodium. Challenge yourself to eat more fresh foods and fewer processed foods. You may find that after gradually decreasing salt use, your taste buds will adjust and you will prefer less salt. When shopping, look for low sodium or reduced sodium options. In addition, limit your use of condiments that are typically loaded with sodium, such as salad dressings, sauces, dips, and ketchup. Foods from animal sources like meat, poultry, eggs, butter, cheese, and whole milk are major sources of cholesterol. The cholesterol in eggs is found in the yolks, not the whites. 5. Be lean with protein. Good sources of protein include lean meat, poultry, and low-fat dairy products. But legumes like beans, peas, and lentils are good sources of protein and can be substituted for meat. They contain little fat and no cholesterol and are high in fiber. If you really want to boost your heart health, eat more fish. The omega-3 fatty acids found in many types of the fish, including salmon, mackerel, herring, and trout, appear to reduce the risk of dying of heart disease. The American Heart Association recommends eating fish at least twice a week. Many varieties of nuts, such as walnuts, almonds, hazelnuts, and pecans, contain omega-3 fatty acids and can help lower cholesterol. But nuts are also high in calories, so a small handful is plenty. Be active. Of all the steps you can take for heart health, moving your body is one of the simplest and most important ones. You can start by literally taking a step. Being active can help you in many ways, improving sleep, weight control, concentration, and mood. Regular exercise can help you control blood pressure and cholesterol and may reduce your risk of conditions such as heart disease, stroke, diabetes, osteoporosis, depression, Alzheimer's disease, and erectile dysfunction. The benefits of exercise apply to everyone, no matter what your age, weight, gender, race, health, and fitness level. And the more active you can be, the more it can help you. Even if you can't meet the recommended guideline of about 30 minutes a day, any exercise you do can help improve heart health and reduce your risk of disease. And once you get started, you may find that you want to do more because it just feels good. 5 keys to physical activity and heart health. Number 1, stand up for heart health. Researchers have found that a sedentary lifestyle, that means spending a lot of time seated at a desk, in a car, or in front of a television or computer monitor, increases your risk of death from heart disease. 2. Start with 10. Begin with 10 minutes or so of moderate physical activity, such as a brisk walk, something that gets your heart pumping and makes your breathing faster, but still allows you to carry on a conversation. As you become more fit, spend more time and work a little harder on being active. You can increase the duration at all once or schedule short periods of activity throughout the day. Your eventual goal might be to be active for 30 minutes on most days of week. Mixed up, work harder on some days and lighter on others. 3. Add intervals. Consider trying a technique that athletes often use to improve performance. Interval training involves alternating short periods of higher intensity activity with periods of lower intensity activity. Interval training not only improves endurance, allowing you to exercise for longer periods, but also increases the number of calories you burn during exercise. 4. Boost your strength. Muscular fitness is another key component of an exercise program. Strength training at least twice a week can help you increase bone and muscle strength and reduce your risk of injury during activity. With regular strength training, you can reduce your body fat, increase your lean muscle mass, and burn calories more effectively. 5. Pick things you enjoy. Chances are just knowing that physical activity is vital for good health is not going to motivate you to exercise. Likely, there is a recurring theme that goes along with thoughts of exercise. The trick is to find out what it takes to get you moving, what interests you, what is fun. Make sure your workouts include things you enjoy. Sleep well. You spend about 1/3 of your life sleeping for a reason. It helps maintain good physical and mental health, reduces stress, and re-energize your body. But for many people, a good night's sleep is elusive. According to CDC, Center for Disease Control and Prevention, chronic sleep deprivation impairs your attentiveness, coordination, and reaction time. It also increases your risks of obesity, high blood pressure, heart attack, diabetes, and depression. And sleepiness is the all too common cause of accidents and fatalities in the workplace and on the highways. 5 keys to sleep and heart health. Use these basic goals to improve your sleep and heart health. Number 1, aim for consistent quality sleep every night. To help you get enough quality sleep every night, know your sleep patterns, follow a sleep schedule, keep the same schedule on weekends, know your slumber number. 2. Get adequate sleep to help you lose weight. Without enough sleep, you are more prone to weight gain. Lack of sleep stimulates your body to produce hormones that make you feel hungry, and your body produces less of the substances that break down fat. Because you are tired, you are also less active. This is a sure recipe for weight trouble. Making sure you get an adequate amount of sleep can help correct many of the sleep problems. 3. Establish a consistent bedtime routine. Calm your mind. Create a quiet, dark, cool sleeping environment. Turn off electronic devices. Don't eat a big meal just before bedtime. Limit strenuous evening activity. Resist the urge to nap late in the day. 4. Be cautious about caffeine and alcohol. 5. Make sure you don't have a sleep disorder. Sleep problems, obesity, and heart disease often form a troublesome triangle. One condition leads to the other, which leads to the other, which leads to the other, with lots of interaction among them. Obesity is a significant cause of the sleep apnea, and many obese people have sleep apnea. Both conditions increase the risk of cardiovascular disease. All three sides of the triangle are linked to similar metabolic disorders such as diabetes, which in itself carries a high risk of heart disease. Deal with tobacco and weight. These two factors are the elephants in the room. They are both big health risks, but no one wants to deal with them. They may be blocking your way to heart health. If you use tobacco or you are overweight, addressing either of these factors becomes a priority. Tobacco and heart health. Cigarette smoking is the leading preventable cause of death and disease. Millions of people develop lethal or debilitating conditions, including heart disease, because they smoke or have smoked in the past. Smoking damages several organs and tissues and can make chronic conditions such as asthma worse. In short, tobacco affects just about every aspect of your health. Tobacco use has a powerful effect on your cardiovascular health. Smoking narrows your blood vessels, raises blood pressure, and increases the risk of blood clots. Any tobacco use, including smokeless tobacco, increases your risk of heart attack and stroke. Even social smoking, 1 or 2 cigarettes a day, increases the chance of heart disease. Being exposed to second-hand smoke increases your risk of heart disease by 25% or more. The good news is, quitting tobacco brings immediate benefits. Within 20 minutes of smoking that last cigarette, your heart rate drops. Within a year, your risk of heart attack is cut in half. Within 2 to 3 years, your risk is the same as that of a non-smoker. Stopping smoking is a process that doesn't happen all at once. Start with manageable amounts of time and work your way up to a whole day without smoking. Then take it one day at a time. Don't attempt all on your own. There are many resources that can help you. Weight and heart health. Weight and heart health. Over the last 3 decades, obesity rates have skyrocketed across the world. More than 2/3 of adults are now overweight or obese, as are almost 1/3 of children. The reason for the epidemic are straightforward. People are eating more and being less active. Being overweight or obese increases your risk of heart disease and conditions that lead to heart disease, including high blood pressure, high cholesterol and triglyceride levels, diabetes and sleep apnea. Obesity also puts you at risk of other chronic health conditions including asthma and arthritis as well as some cancers. Losing weight reduces or reverses many of these risks. How do you know if weight is putting your health at risk? Check the body mass index, BMI. If your BMI number is 25 or more, you are likely overweight or obese and could benefit from weight loss. Consult your doctor about your BMI, weight goals and appropriate steps you can take to reach them. Much of your success with weight loss is in the planning. Don't focus too much on the long-term goal of losing 40 pounds. It won't happen without a plan. Trying to lose 40 pounds without a good weight loss plan is like trying to make $1 million without a good financial plan. Instead, concentrate on losing 1 pound at a time. Many people also find that when they lose weight and are more active, they feel better. Make sure you are ready. Find your personal motivation. Choose your approach. Involve your doctor. Get support. Tackle one change at a time. Manage your stress. Pick a date. Choose a start day to quit smoking or lose weight. Know your numbers. It just takes a phone call to your doctor or healthcare provider to schedule the tests you need for a heart checkup. The basic tests, including those for blood pressure and cholesterol, are common ones. Knowing your numbers can be especially important if you are a woman. Women are less likely to be treated for heart disease than are men. 5 numbers for better heart health. Numbers associated with following tests can help identify your potential risk of heart disease: blood pressure, cholesterol, triglycerides, body mass index, and blood sugar. Blood pressure measures the force of circulating blood that is pressing against your artery walls. The harder your heart pumps and the less flexible your artery walls become, the higher your blood pressure. High blood pressure, also known as hypertension, damages and scars the arteries. It is one of the major risk factors for heart disease. If not treated, high blood pressure can cause a heart attack, stroke, or heart failure. Blood pressure categories. Normal is systolic 120, diastolic 80. Pre-hypertension. Systolic 120 to 139, diastolic 80 to 89. Hypertension 140 and over, systolic, 90 and over, diastolic. Cholesterol. Your body needs cholesterol, a waxy substance found in the fats, lipids, carried in your body bloodstream to build healthy cells. But too much cholesterol causes fatty deposits to build up in your blood vessels. This can lead to narrowed or blocked arteries, known as atherosclerosis, a major cause of heart disease. Most people with high cholesterol feel fine and don't experience signs or symptoms. Being tested and knowing the test results is the best way to keep cholesterol levels within healthy limits. The simple blood test determines low density lipoprotein, LDL cholesterol. This is sometimes called bad cholesterol. Too much of it in your blood causes atherosclerosis. The deposits can rupture, leading to heart attack or stroke. High density lipoprotein, HDL cholesterol. This is sometimes called good cholesterol because it helps carry away excess LDL cholesterol in your body. Total cholesterol. This is the sum of your blood's cholesterol content. Triglycerides are another type of fat in your bloodstream. When you eat, your body converts calories it doesn't immediately need into triglycerides. High triglyceride levels are common in people who are overweight or have diabetes, do not exercise regularly, eat too many sweets and carbohydrates, or drink too much alcohol. Triglyceride levels above 200 are linked to an increased risk of death from cardiovascular disease. Body mass index, BMI. Weight is typically measured by a number known as your body mass index, which takes both your weight and height into account. Your BMI number indicates whether you are at a healthy weight or you are overweight or obese. Normal BMI range is 18.5 to 25. Overweight is 25 to 30. Obesity starts from 30 to 40. Extremely obese means 40 and over BMI. Blood sugar, glucose in your body in your body's main fuel source. Blood sugar is your body's main fuel source. If dangerous levels of blood sugar build up in your bloodstream, you can develop diabetes. The main test for diagnosing diabetes is a fasting plasma glucose test. Fasting glucose. Normal is 99 and under. Increased risk or prediabetes is 100 to 125. Diabetes is 126 and over. A key to preventing heart disease is proactively seeking information to reduce your risk. It starts with a general physical examination. If individuals, healthcare providers, and society work together, most heart attacks could be prevented. If you have diabetes, the glycated hemoglobin or A1C test can indicate how well you have been managing your blood sugar over the previous 2 to 3 months. You are doing well if the tests show that your average glucose level has been at 5.7% or lower. Metabolic syndrome. A cluster of risk factors known in combination is metabolic syndrome greatly increases your risk of heart disease. You have metabolic syndrome if you have 3 or more of the following. Waist circumference of more than 35 inches for women or more than 40 inches for men. Triglyceride level of 150 milligrams per dl or higher, or you are receiving treatment for high triglycerides. HDL cholesterol level of 40 mg per dl or less in men or 50 mg per dl or less in women, or you are receiving treatment for low HDL. Blood pressure higher than 130 mm mercury systolic or 85 mm mercury diastolic, or you are receiving treatment for high blood pressure. Fasting blood sugar of 100 mg per dl or higher, or you are receiving treatment for higher blood sugar. If you have the metabolic syndrome, work with your doctor to develop an aggressive plan to improve and maintain your numbers. Know your history. To prevent problems in the future, you may need to look at the past. Find out what to look for in your own medical history and that of your family to better understand your risk of heart disease. Did you know that a condition that has affected you or a family member in the past may be a strong predictor of your future health risks? For example, having a close relative who developed heart disease at a young age increases your chance of heart disease. That may sound scary, but don't panic. Just because certain genes increase your risk does not mean you can't lessen those risks. There are things you can do to reduce your risks, including adopting a healthier lifestyle. It is important to check your medical history. Women's unique risks. Women have specific issues to consider when reviewing their medical histories. Pregnancy complications, oral contraceptive use, postmenopausal hormone therapy, autoimmune disease like rheumatoid arthritis and lupus are examples of autoimmune disease. Other concerns. Women are more likely than or men to have diabetes. Depression, which is more common in women, is another concern. Preventing sudden cardiac death in children relies on 3 strategies. Don't ignore abrupt fainting episode, especially during exercise. Know your family history. Encourage your community to make easy access to extend to external defibrillators a priority. Set your targets. Your objective is to prevent heart disease, but how to plan for such a long-term complex goal? Test numbers and medical histories have helped you and your doctor assess the current state of as well as potential risks to your heart health. Now, your focus can be turned to the future and how to influence it for the better. You will begin collaborating with your healthcare team to set targets, the long-term goals that help reduce your risk factors for heart disease. There is a saying that heart disease is what nature gives you for breaking its rules. But you have a second chance. Healthy lifestyle habits can help you reduce a majority of your risks for heart attack. The more you reduce risk, the bigger the payoff. Major risk factors for heart disease include diabetes, smoking, high blood pressure, unhealthy cholesterol levels, LDL, family history of early heart disease, obesity, lack of physical activity, established heart disease. Other risk factors include advancing age, unhealthy diet, sleep problems, and stress. Once you have established your primary risk factors, you and your doctor can prioritize and set your targets. Typically, your doctor will help you establish the targets at achievable levels that will make positive impacts on your risk factors. Your next step is identifying performance goals that help you reach your targets. These goals should be simple and practical. Take your medications. There is a vast array of medications you can take to improve your health, but that is not the focus of this plan. The key word in this plan is take. A common challenge for anyone living with heart disease is taking medications regularly as prescribed. You will benefit from eating healthier, moving more, and sleeping better. But these changes may accomplish only so much. Medications also may be necessary to prevent or manage heart disease. This is especially true for underlying medical conditions that lifestyle changes alone cannot modify sufficiently. Different medications can improve heart function, lower cholesterol, and treat high blood pressure, heart failure, or atrial fibrillation. The goal is to take your medicines correctly and consistently for as long as you need them. And with heart drugs, that often means the rest of your life. If you stop taking your medications, your condition may worsen or your symptoms may return. If you don't take your medications as directed, they may not work or they could cause harmful side effects. So, why so many people struggle to take their medications as their doctors have ordered? You are more likely to take all medications correctly if you understand why you take them and you develop routines for when and how to take them. Getting at least some answers to some questions about each medicine you take will help. Take your drugs at the same time every day. Connect pill taking to other daily habits such as before meals or after teeth brushing. Unpleasant side effects. Know what symptoms to watch for. Discuss with your doctor or see if your prescription can be adjusted. Too many medications. Organize your pills in a pill box at the beginning of each week. Ask your doctor about ways to reduce the number of drugs. Too expensive. Ask your doctor if a lower cost or generic version is available. Travel, illness, or change in routine. Plan ahead for how and when you will refill prescriptions. Plan for emergencies. Just as you might plan for what to do in case of fire, knowing what to do if you or someone else faces a cardiac emergency can make a life or death difference. Whether you have been diagnosed with heart disease or not, it makes sense for you to be prepared for a heart attack or other heart-related emergency. A quick response to an emergency is much easier if you have had a chance to think through in advance what to do if you or someone else experiences alarming symptoms. Consider what you would do if this happens at home or at work, if you are traveling, or if it occurs in the middle of the night. Prepare a response plan for heart-related emergencies, including contact numbers. Share it with your family. With a plan in place, you will save time in case of an emergency and may help save a life. Memorize the signs and symptoms of heart attack. Know what to do for someone who is having cardiac arrest. Consider taking a course in cardiopulmonary resuscitation, CPR, through the American Heart Association or American Red Cross or whatever is available in your country or in your state. Create a plan for responding to heart-related emergencies. 5 keys for emergencies. Use these keys to plan for the worst while hoping for the best and doing everything to reduce your risk of ever needing these plans. Number 1, recognize the warning signs. Heart attack emergency. Chest pain is the classic symptom, but it often doesn't feel the way people expect. Rather than an intense, sudden pain, it may start gradually and feel like uncomfortable pressure in the center of the chest. The discomfort lasts for a few minutes or goes away and comes back. Chest discomfort. Discomfort or pain in your jaw, neck, back, arms, or stomach. Shortness of breath. Weakness, lightheadedness, or loss of consciousness. Cold sweat, nausea, and vomiting. High blood pressure emergency. Extremely high blood pressure can cause an emergency. Without treatment, the crisis can lead to a stroke, heart attack, and other life-threatening problems. There may be chest pain, shortness of breath, back pain, numbness or weakness, change in vision, difficulty in speaking. Heart failure emergency. Heart failure can cause a sudden, life-threatening buildup of fluid in the lungs. Trouble breathing or a feeling of suffocating. Bubbly, wheezing or gasping around when you breathe. Pink, frothy sputum when you cough. Breathing difficulty along with profuse sweating. Blue or grey tone to your skin. Severe drop in blood pressure resulting in lightheadedness, dizziness, weakness, or fainting. Delay is deadly. If you notice signs and symptoms that could signal a heart emergency, act immediately and seek emergency help. Do not drive to the hospital or have a family member or friend take you unless that is your only option. Even if you are not sure it is a heart attack, whenever something feels different, get it checked out. The first hour of a heart attack is the most dangerous because an irregular heart rhythm may develop, leading to sudden cardiac arrest. In addition, treatment is most effective when it is given within an hour of the start of the signs and symptoms. Even if your heart stops beating, emergency personnel often can deliver a life-saving shock to restart the heart. Start cardiopulmonary resuscitation (CPR) if someone is in trouble. Anyone can help save a life. Even if you haven't been trained in cardiopulmonary resuscitation, a new hands-on CPR technique is easy to learn and can dramatically improve the chances of survival. If you see an adult collapse suddenly, here is what you can do. Check to see if the person is conscious. If the person appears unconscious, see if he or she is responsive to your voice. You can ask, "Are you okay?" and to tapping on the shoulder. If the person does not respond, seek emergency support. Roll the person onto his or her back. Kneel beside the person next to the neck and shoulders. Prepare to start chest compressions. Place your hands one on top of the other over the center of the chest. Keep elbows straight and shoulder directly over your hands. Push hard and fast, compressing the chest at least 2 inches. Use your body weight as you push straight down. Let the chest rise without taking your hands off the chest. Push at a rate of 100 or more compressions a minute. Keep repeating these actions without interruption until medical help arrives or the person shows obvious signs of recovery. If you tire and someone else is nearby, ask that person to take over, keeping interruptions to a minimum. Conventional CPR combines chest compressions with mouth-to-mouth breathing. If you are trained in conventional CPR and are confident in its use, you should follow that technique. Hands-only CPR simplifies the process if you are not trained in conventional CPR or are uncomfortable with mouth-to-mouth contact. Sudden cardiac arrest isn't the same as a heart attack. A heart attack occurs when blood supply to the heart is cut off. In cardiac arrest, electrical impulses in the heart are chaotic, rapid, or cease altogether, causing the heart to stop beating. Immediate CPR is critical to treating cardiac arrest. Use defibrillation if necessary. Involve your family. Enjoy life. A healthy life isn't just about getting all the numbers right. It's also about relaxation and fun, love and laughter. Discover what brings you joy and satisfaction. Just as your genetic makeup, physical fitness, and lifestyle habits influence your heart health, so do your mental and emotional states. Distrust, hostility, chronic stress, pessimism, hopelessness, and lack of social connection have all been linked to heart problems. Take 10 minutes for myself each day to do something I enjoy, such as reading, working on a hobby, or listening to music. Find an opportunity to volunteer in my community, even if it is only a couple of hours on a weekend. Get in touch with friends, call, email, or meet for a walk or a meal. These are the simple goals you can achieve. 5 keys to enjoying life. 1. Build a social support network. Volunteer. Join a club, take a class, participate in a faith community, look online, show appreciation, see the good in people, stay in touch, be a good listener, don't overdo it. Surround yourself with support. 2. Relax and have fun. Schedule time for leisure. Practice relaxation techniques. Laugh. Get a pet. 3. Reduce stress. Although you can't completely eliminate stress from your life, you can manage its impact. Identify causes of stress. Recognize negative reactions. Accept the things you can't change. Slow down and scale back. Get organized. Plan ahead. Cut down on information overload. Cultivate spirituality. And get support. 4. Learn to adapt. Learn to be adaptable. As the saying goes, the one constant in life is change. Learn how to adapt to changing needs and situation. From minor shifts in routine, such as going on vacation, to major setbacks, such as a new diagnosis or death in the family. Make every day meaningful. Learn from experience. Remain hopeful. Be proactive. 5. Find a realistic balance. As you focus on heart health, don't expect perfection. In this lifelong journey, you will experience many ups and downs. If you struggle with a part of your plan, maybe you haven't been able to lose weight, or you still don't like to exercise, avoid the tendency to conclude you are a failure and give up on everything. Heart health is not an all or nothing proposition. You do what you can. Be realistic about what works best for you. Embrace a comfortable middle ground between doing things perfectly and doing nothing at all. Develop the habit of optimism and learn to turn negative thoughts into positive ones. The process of working towards your goals brings satisfaction and a sense of purpose. How your heart works. Most of the people know that heart pumps blood throughout the body, but one may not know how complex it works really. Its workings really are. Your heart has 4 separate chambers and 4 valves that function as one-way doors to keep blood flowing in the proper direction. Your heart has its own electrical system that triggers each heartbeat. Your heart pumps about 5 quarts of blood in a minute and beats about 100,000 times a day. It supplies not only its own tissues with blood, but every cell in your body through a closed network of 60,000 miles of arteries, veins, and capillaries. Maintaining this blood supply to every part of your body is what makes heart health so important. What can go wrong? The flow of blood through your heart and circulatory system is an intricate process. Many things can go wrong inside and outside the heart. If blood flow is interrupted or irregular, problems can develop quickly and cascade throughout the rest of your body. Many common forms of heart disease can eventually lead to heart failure, meaning that your heart can't pump enough blood to meet your body needs. Fortunately, most types of heart disease can be prevented, slowed, or even reversed by following the strategies in the Healthy Heart Plan. Heart attack A heart attack is one of the most dreaded and common complications of heart disease. A heart attack occurs when a coronary artery is suddenly blocked by a blood clot, depriving part of the heart muscle of blood. The tissue in this section is quickly damaged or dies. The causes of heart attack include atherosclerosis, a progressive narrowing of your arteries due to the buildup of fat and other substances that form plaques. Multiple blockages. In any artery, plaques can form multiple narrowed areas, stenosis, or blockages, occlusions. These plaques limit blood flow. Unstable plaques. Some plaques become unstable, developing cracks in the lining and rupturing, which allows fat and other substances to pour into the artery. Dangerous clot. A blood clot forms where plaques rupture. The clot can completely block blood flow through the vessel, causing a heart attack. Heart function. Many conditions may interfere with your heart's pumping action. A normal heart, upper left, pumps out about 70 cubic centimeters of blood with every beat. The ejection fraction is the percentage of the blood pumped out of the heart each time it contracts. Since the heart doesn't empty completely, the ejection fraction is never 100%. Instead, it is normally between 50 and 70%. The remaining 50 to 30% remains in the ventricle. If your heart muscle weakens, it can't pump as much blood with each beat. That forces the heart to beat faster to meet your body's demands. Over time, the heart usually tries to compensate by enlarging to fill with more blood. The result, lower left, is an enlarged, weakened heart pumping a reduced amount of blood with each beat. In this example, only about 40 cc of blood. The ejection fraction is just one measure of your heart's function. It can also be misleading. In some conditions such as long-term high blood pressure, the heart muscle may stiffen, making it harder for your heart to fill between beats. Heart failure. Untreated heart disease of any kind and other non-cardiac conditions such as severe infection can make the heart too weak or too stiff to pump effectively. When the heart does not pump enough blood to meet your needs, blood often backs up and causes fluid to build up in your lungs, congestion, and in your legs, causing your legs to swell and turn blue from lack of oxygenated blood flow. Cyanosis. This fluid in your lungs can make you short of breath. This is worse at night when more blood returns back to the heart. Coronary artery disease, CAD. It is the major culprit behind heart attacks. Heart disease is the leading cause of death of both men and women globally, and the most common form of heart disease is coronary artery disease. The coronary arteries provide your heart muscle with a steady supply of blood. The oxygen and nutrients in blood give your heart the energy to do its job, continuously pumping blood out to your lungs and to the other parts of your body. When the arteries become damaged or blocked, partially or completely, the condition is known as coronary artery disease. Possible causes of this damage include smoking, high blood pressure, high cholesterol, diabetes, infections, even the aging process. Treatment for coronary artery disease starts with lifestyle changes that provide a solid foundation for heart health. It's crucial that you control your blood pressure, high cholesterol, and diabetes. Other options available are medications, coronary angioplasty, coronary bypass surgery. Complications of coronary artery disease include heart attack, heart failure, abnormal heart rhythm, arrhythmia, and sudden cardiac death. Adapting the healthy heart plan to coronary artery disease. Reducing your elevated risk of heart attack is a primary concern if you have coronary heart disease. Take following steps. Drop your LDL cholesterol level to a lower target number. Get into a cardiac rehabilitation program. Respect your medications. Be alert for warning signs and be ready to seek help. Ask your doctor if you need a heart device. Heart failure. It does not mean that your heart has totally stopped working. Rather, it means your heart is not doing its job as well as it should. The heart muscle has become too weak or too stiff to pump enough blood to meet your body's needs. Heart failure often develops after other conditions such as heart attack or arrhythmias have damaged the heart. The main pumping chambers, the ventricles, become weakened and stretched, that is dilated, unable to pump blood with much force. Or the ventricles become stiff and don't fill with enough blood between heartbeats, causing blood to back up into the lungs, liver, abdomen, or legs and feet. Congestion. Heart failure also may occur because your heart simply cannot pump enough blood to meet the demand. Causes of heart failure. A variety of medical conditions can reduce your heart's ability to pump blood effectively. Heart failure can involve the left side, right side, or both sides of your heart. Causes include coronary artery disease, diabetes, high blood pressure, faulty heart valves, birth defects of the heart, abnormal heart rhythms, arrhythmias, myocarditis, cardiomyopathy, which may be dilated cardiomyopathy, hypertrophic cardiomyopathy, restrictive cardiomyopathy. Symptoms. Heart failure can be ongoing, that's chronic, or start suddenly with new or recurring symptoms. Acute. Symptoms may include shortness of breath, fatigue and weakness, swelling in your legs, ankle and feet, rapid or irregular heartbeat, reduced ability to exercise, persistent cough or wheezing with white or pink phlegm, swelling of your abdomen, sudden weight gain, lack of appetite and nausea, difficulty concentrating or decreased alertness. A healthy heart plan for heart failure. If you have heart failure, take these steps. Treat salt as an enemy. Weigh yourself each morning before breakfast. Watch how much you drink. Exercise safely. Pace yourself. Maintain about the same level of daily activity and rest following difficult tasks. Watch your levels of potassium. Get checked for sleep disorders. Ask about family screening. Find out if you need an ICD. Some people with heart failure or cardiomyopathy will have a higher risk of dangerous heart rhythms. An ICD monitors your heart rhythms and can treat dangerous life-threatening heart rhythms with pacing or by delivering an electric shock. Arrhythmias. Many people experience an occasional fluttering of their heart, especially during stressful times or when exercising. But when does the occasional fluttering become a concern? Or what does it mean when your doctor tells you that there may be a problem with your heart's rhythm that you did not know anything about? If you sometimes feel like your heart is racing or skipping a beat for a short time, it's probably not cause for alarm. But if an abnormal heartbeat persists, it could signal that something is amiss in the pathway through which your heart's electrical signals travel. Heart rhythm problems are called arrhythmias. Arrhythmias are caused by abnormalities along the pathway that your heart's electrical signals travel to make your heart beat. Tachycardia refers to a fast heartbeat, a resting heart rate greater than 100 beats a minute. Bradycardia refers to a slow heartbeat, a resting heart rate less than 60 beats a minute. Atrial fibrillation or atrial flutter, a form of tachycardia, can be more serious. These arrhythmias can cause blood clots to form, increasing your risk for heart attack or stroke. Tachycardia in the lower chambers of your heart ventricles are often very dangerous. During persistent ventricular tachycardia, the heart cannot pump enough blood to your body, resulting in fainting, organ damage, and cardiac arrest. Arrhythmia signs and symptoms include fluttering in the chest, racing heartbeat, slow heartbeat, skipped heartbeats, chest pain, shortness of breath, difficulty performing exercise, lightheadedness, dizziness, fainting, syncope, or near fainting. Complications include stroke and heart failure. Adapting the healthy heart plan to arrhythmias. Get your doctor's okay before exercising. Ask your doctor about blood thinning medications. Cut back on caffeine and alcohol. Quit smoking. Ask your doctor if you need an implanted medical device. ICD. Find ways to reduce the amount of stress in your life. Be cautious with over-the-counter medications and supplements. Heart valve disorders can be a stealthy problem. They often go undetected for years without causing symptoms. These disorders typically show up in older adults and will likely become more common as the general population ages. 4 valves keep blood flowing through the 4 chambers of the heart. For the valves consist of strong, thin flaps of tissue called leaflets, which open and close with each heartbeat. When the pressure of the blood pushes against the leaflets, they swing open like one-way gates and blood passes through. When the pressure lessens, the leaflets close, preventing blood from moving backwards. The valves allow blood to flow in only one direction through the heart. Some of the most common types of heart valve disorders include aortic stenosis, mitral stenosis, aortic regurgitation, mitral regurgitation. Causes include calcium buildup, wear and tear, rheumatic fever, birth defects, infections, and other causes. Complications include heart failure, abnormal heart rhythm, chest pain, angina, infections, endocarditis, lung problems. A healthy heart plan for heart valve disorders. See your doctor if you develop symptoms like chest pain, dizziness, fatigue and weakness, shortness of breath, swelling, rapid or irregular heartbeat, reduced ability to exercise. 2. Exercise safely. 3. Ask if you need antibiotics before having dental work. 4. Check if your immediate family may need to be screened. 5. Stay in the shape for a possible surgery. Vascular disorders. Your heart isn't the only part of your body where atherosclerosis, high blood pressure and high cholesterol can take a toll. If you have blocked or narrowed arteries in your heart, you have an increased risk of vascular disease. The opposite also is true. If you have vascular disease, you have an increased risk of heart disease. Narrowed arteries in your heart can lead to chest pain and progress to a heart attack. And the effects elsewhere in your body can be just as detrimental. Narrowed arteries to your limbs, brain, kidneys, or lungs can become serious heart problems. Fortunately, taking simple steps, even walking just a few minutes several times a day, can have a big effect on your vascular health. Vascular health and sex. Following the healthy heart plan can have greater benefits than a reduced risk of heart disease. For men, atherosclerosis and high blood pressure can also affect blood vessels in the penis, causing erectile dysfunction (ED). Because of the arteries to the penis are narrower than those near your heart, ED may show up 3 to 5 years before life-threatening problems such as heart attack and stroke. Erectile dysfunction (ED) is a common condition. It affects about 1 out of 5 men. Although there are medications to treat ED, following a heart-healthy lifestyle may reduce the need for those medications or may help those medications work better. In addition to diet, exercise, and good quality sleep, statins can be particularly effective in improving vascular health for men who have ED. The earlier you start the healthy heart plan, the more your risk of developing heart disease decreases. Adapting the healthy heart plan to vascular disease. Number 1, quit tobacco use and avoid second-hand smoke. 2, find out if you have exercise or weightlifting restrictions. 3, modify your walking program. 4, reach for a low LDL cholesterol target. 5, know your family history. 6, protect your feet if you have peripheral artery disease. 7, keep up with follow-up appointments. Overcome your eating obstacles. Long-term success with getting healthy sometimes follows a bumpy, uneven path, especially when it comes to adapting to a healthy way of eating. Many obstacles can keep you from reaching your nutritional goals. Learning to identify potential roadblocks and confront personal temptations is a key part of achieving success. To make it past the rough spots, it's important to have strategies ready to guide your responses as problem arises. Find a healthy weight. One of the best things you can do to keep your heart healthy is to be at a healthy weight. If you are obese, you are more likely to develop a number of the serious health problems, including high cholesterol, high blood pressure, and heart disease. But do you know what a healthy weight is for you? Simply put, a healthy weight means you have the right amount of the body fat in relation to your overall body mass. But factors such as your height, age, sex, bone density, and muscle mass also may be taken into account. If you are looking for a fresh approach to weight loss, healthy weight pyramid is your answer. The base of the pyramid focuses on generous amounts of food that contain a small number of calories in a large volume of food, particularly healthy fruits and vegetables. As the categories of the pyramid get narrower, you choose smaller amounts of food, including whole grains, lean protein, and dairy, healthy fats, and even sweets. Monitor your mental health. Stress, depression, anxiety. You might wonder what they have to do with your heart. The fact is that your mood can affect your long-term heart health, making it more likely for things to go wrong. Also, people who have a heart condition or have had a heart attack are more likely to experience depression or anxiety, which takes a further toll on your health. Finding inner peace to relieve daily stress. Start your morning in the here and now. Spend 10 to 15 minutes a day with nature. Transition mindfully from work to home. Your health is in your hands. Plan preventing and conquering heart disease.